This is Late Night Health, the radio show and video online program that cares about the most important part of your life, your health. Hi, I'm Mark Alyn, and during the next few minutes, we're going to spend some time with Dr. Greg Celaya. Dr. Celaya is a functional medicine specialist, and we are going to talk about something that, frankly, I've never heard about today. H. pylori? Is that right?
H. pylori.
Like pylori, okay.
Yeah. It's actually a bacteria. Do you remember when you were a kid and, people came down with ulcers? And what was the cause of those ulcers? Do you remember way back when?
I don't, but I think I'm going to guess bacteria.
Well, yeah, good guess at this point. Way back when they mentioned that it was stress or spicy food, or they had 50 different ideas, right? And a couple of scientists said, this can't be the case. So they isolated a bacteria in 1982 that they found that was pertinent for these ulcers. They colonized this bacteria, and it's in the gastric mucosa, and it's present in about 50% of the people.
Oh my gosh. But not everybody has an ulcer. And are ulcers found just in the stomach, or are they throughout the gut, including the small and large intestine and even the colon?
Yeah, they're found in different places, and not everybody has ulcers, but you'll find that so many doctors take H. pylori, which is the name that we're talking about, and no matter what, they eradicate it. And I understand the causes for doctors doing that. We're not 100% sure. Is it decent, or is it a good thing for some people? And some of the research is showing that it is. But on the other hand, there's a problem with it as well, because there's so many different issues that can be related to H. pylori. One of the issues that we see is that this gram-negative bacteria has a cell wall and then an outer membrane on top of it. So treating it with medications or antibiotics is a little bit difficult because you have two walls now that you have to deal with. In addition to that, each of these bacteria has what we call an efflux pump. What that is it's a pump that enables the bacteria to come in one of the cell walls or the outer membrane, and then before it actually goes through the cell membrane, the inner layer, it's pumped right back out. So this bacteria is pretty darn smart when it comes to evading, antibacterial components.
Well, let's take a look at ulcers. I mean, back in the day, if you will, if you watch an old medical show and somebody has an ulcer, what they do is they say, drink milk. You remember that?
Sure, and it may have made a difference for some people, but the main reason for these ulcers is this H. pylori in most circumstances. Now, of course, there's always options, and there's always different things that can cause different things in different people, but that's usually what they found. And at that point, they started treating people with antibiotics. And
I believe it's a special antibiotics, aren't they?
Well, like I said, because of the cell walls, the outer membrane, and the efflux pump, it makes it very hard to treat this bacteria. This bacteria burrows into the gut wall. And as a side note, it produces urease, which is an enzyme that helps break down urea into CO2 and ammonia. And when you break down into ammonia, you're increasing the stomach area's pH. So instead of a pH of 2 acidic, which we need to digest food, your pH is getting up too close to 11, which doesn't necessarily digest normal food the way we want it to be digested.
So it's in a base or alkaline state.
Well, it produces different things, and you have cytotoxins that are produced, and all the excrement that these bacteria produce can be a big issue. But this one helps change your pH, and it can lead to gastritis, ulcer, and eventually perhaps even cancer.
Oh my! So, what is the methodology that you would recommend if somebody has H. pylori?
Well, I mean, there's so many different issues, and you have to always look at symptoms. You get burning, abdominal pain, you've got nausea, low appetite, burping, bloating, weight loss. There's a lot of different symptoms, and some people have it and have zero symptoms. They're finding that H. pylori can be beneficial for some people, but it can cause leaky gut, autoimmunity, increased thyroid antibodies, cardiovascular disease, rosacea, Raynaud's phenomena, allergies, B12 deficiency, migraines, anxiety, and even depression. Some can cause hormone imbalances, fungus overgrowth, and glaucoma. I mean, there's so many different things that can be as a result of H. pylori. But
at the same time, what are some of the benefits of H. pylori?
They're finding some autoimmunities are decreased by it. I mean, there's a whole list of things that they're doing research in this aspect. But autoimmunity is kind of a tough one because it can lead to just about anything. So, for example, let's say you don't have appropriate stomach acid, you're not digesting the food the way you should, you end up with leaky gut. Leaky gut can lead to autoimmunity. Autoimmunity can come in forms of thyroid issues, nerve issues, MS, ALS, rheumatoid arthritis, and the list goes on to hundreds. And so it's a hard one. Is it a good thing or is it a bad thing?
Let's talk about stomach acid, for a minute as it relates to H. pylori. And that would be a lot of people, if they have an upset stomach, they take an antacid. Recently, in fact, I think you've mentioned it to me, either on a previous program or on the radio show, that maybe people have not enough stomach acid. And so they should take an acid increaser supplement.
Yeah, it really depends what's going on. When they treat H. pylori, they usually give antibiotics, anywhere from 2 to 4 of them, because you have to get past that cell membrane and cell wall and efflux pumps. In addition to that, they usually give proton pump inhibitors to decrease the gastric juices so those antibiotics can do something. The problem is the PPIs, the proton pump inhibitors, have been shown that they possibly can lead to more issues, gastritis, cancers, etc. So it's a hard one going down the path to try and treat it within that 10 to 14 days, which the antibiotics have their benefit, right? It's a matter of treating it hard and fast. When we look at it, we treat it quite a bit differently. We treat it really slowly to make sure that we eradicate it over time. And the most important thing is we don't want to completely destroy your body's microbiome, which those hardcore antibiotics do. And the microbiome is just absolutely huge. We're going to have to do a whole video just on microbiome and your gut bacteria.
Absolutely.
Because it is, I'm going to conferences after conferences, and just the new research coming out is just amazing.
Let's take a look at something, and that is that, this bacteria that may be beneficial, may not be beneficial, killing all the biotics, if you will, or the biome in the body is certainly not a good idea. What would your method of treatment be? I mean, would it be diet related, supplement related, combination? How would you go about treating the H. pylori bacteria?
Well, the first thing is you have to have the right testing. A lot of the testing that regular doctors do is they're looking at IgG, IgA, IgM. They're looking at breath, CO2, sometimes endoscopy. I look at DNA. I want to know what's going on. Do we have a dysbiosis, an imbalance of the bacteria of your gut that aren't really controlling the bad guys, like maybe H. pylori? In addition to that, we're looking in depth and detail at diet, which is really important because you have to be able to feed the good guys well so they can control the bad guys, right? A lot of processed foods, a lot of sugars, you're going to start to increase the bad guys, and therefore you don't have enough good guys to control them, right? Does that make sense?
Yeah, it does. That does make sense. So, and you do test for this? Can you test for H. pylori to see if a person has it or not?
Yeah, like I said, there are simple breath tests. I like to use a DNA test, where we take a look and see what's coming out in DNA. And I think we've talked about this before, but it's real important to make sure that you look at everything, including the bacteria that don't breathe oxygen, because when they come out, you can't culture them. So you really don't know what's going on. I want to make sure I understand everything that's in there, so we kill it immediately and then test DNA. So we're looking for the beneficial bacteria, the pathological bacteria, the parasites. There's a whole laundry list of different things we're looking for.
All right, I don't understand something. I'm sorry to interrupt.
Sure.
So you do a DNA test, which is a cotton swab in the mouth?
No, we're looking at a stool test. So we get a sample of the stool, and we put it in a solution that kills everything. We then send it to the lab, and the lab runs DNA on everything they find that's in the stool. And so it's accurate. It can tell me not only what I have, but what volumes, right? Because that's important too. We need to know the ratios of everything. And so we need to be able to understand what's happening. Do I have a problem with the good guys? Are there problems with the guys that would take advantage of a bad thing? Do we have pathological? Do we have parasites? And so it's real important. And I love the DNA test because it gives me so much information.
So with that DNA testing, you're not only testing for my DNA, but also the bacteria's DNA, right?
No, we're really not testing that much for your DNA. We're testing the stool, right? Your excrement. Okay. We're seeing what's in there. We can look for other things as well, but the main test is looking at the bacteria. And once we find there's an issue, of course, diet has to change. You can't keep feeding the bad guys. But we work slower. We're not limited to 10 to 14 days. We can work over a period of months to try and eradicate this slowly, which tends to work out well because we're not really degrading the microbiome.
Got it. But at the same time, if somebody is suffering from an ulcer or other gastric issues and problems, we want to make them comfortable. How about making them comfortable?
Oh, absolutely. And the natural approaches do that very, very well. In fact, even more so than the antibiotics. And so our whole objective is to get the patient well as fast as possible, but not have a lot of collateral damage at the same time. And to make sure they're comfortable as well, which is huge. That's why we use so many different things. You know, probiotics, mastic gums, DGL, broccoli sprouts. I mean, there's a long list. You've got black cumin, seed oil, green tea, manuka honey. So there's so many different things that we can do to eradicate H. pylori, but it takes time, and it should take time because all these things took time to get there. You just don't want to eradicate them, and you still have the same habits that you're going to have a problem. And in addition to that, when we treat somebody that has H. pylori, we're usually going to treat the significant other at the same time, because you get it passed back and forth, right? All of a sudden you get well, now your spouse or your significant other has it, and it goes back and forth.
How does a consumer, a patient who's having problems, gut health issues, how do they make the determination on going to somebody like you who's a holistic healer rather than an MD? Because this is a very, very serious issue.
Yeah, I think it really depends upon what your beliefs are. You know, the thing is that we're looking at the latest and greatest of research. We're not just relying on what somebody said down the street or some old folk wives' tale, which, by the way, a lot of them are really true after you research them. But we want to know exactly what's happening.
My old wife has a lot of tells a lot of tales.
Oh, you're going to find yourself out in the street, buddy.
Yeah, I probably am. Okay.
But yeah, so it really depends, right? It depends upon what you want to try to accomplish. You know, we don't treat the symptoms. We go to the root causes. And sometimes H. pylori is not a problem, right? But when it is, we have to work with it, and we have to make sure that we eradicate it. And, you know, it's not uncommon that we will stumble upon it when we're looking at autoimmune causes, because these chronic low-grade infections can create autoimmunity. And so we have to be able to deal with the system. And, you know, you start causing problems with the microbiome and you already have autoimmunity, we're going to have a lot more problems down the road. So it's a matter of trying to minimize the collateral damage and take care of a problem if you need to take care of it in a natural way, working at the cause instead of just the symptom.
Well, I think one of the interesting things that, as a consumer myself, is that gut health seems to be the root of all health, or at least the most of it. You and I have discussed this on previous episodes, and I know that the traditional medical community is starting to look at that as well.
Well, they have to. The science is there. And, unfortunately, it's sometimes hard to patent a product that's going to make you money when you're looking into this arena. And believe me, there's plenty of companies looking at it and trying to create patentable products for that. But your gut health, really, if you think about it, it's the gateway into your body. It's where everything goes. And your gut is one cell wall thick. Well, not one cell wall, but one cell thick. So for something to get into your body, it doesn't take much. So the majority of your immune system is right there waiting to fight anything that's getting in that shouldn't be in.
Anything else that you want to tell us about H. pylori?
No, like I said, it's good and bad. We have to make sure that there are reasons for us working against it. All right, it's like, for example, if we look at testing, DNA testing, we're also going to look at part of the immunity. Is the immune system having a problem in the gut? And do we see increase or decrease immune system responses as a result of? And so it really, you have to look at everything. You just can't look at H. pylori, right? You have to look and see if there's dysbiosis, how the immune system's doing, and H. pylori as well. So there's a lot to look at, and it's not just as simple as you think. It's not just you see H. pylori, you're going to kill it off, because you don't want to put your body through any undue stress. When you do something that your body doesn't need, you're increasing the stress just as much as if you do it the opposite way.
Doctor, thank you very much for joining us here at Late Night Health. If you want information on H. pylori and on Dr. Celaya's methodology of working with and treating patients, you should visit him at drcelaya.com. That's drcelaya.com, drcelaya.com. Look around. There's a lot of great information. Plus, you can sign up for a free 15-minute consultation directly with Dr. Celaya. Dr. Celaya, thank you very much again for joining us today.
Thank you, Mark. It's good to have you, and let's check your H. pylori.
Got it. I'm Mark Alyn for Late Night Health and Dr. Celaya. Check us out at latenighthealth.com. We'll see you on our next show.